Today morning we are going to talk on mental health and with respect to the HIV. So what is exactly mental health? Mental health not in with respect to HIV in general terms. WHO has defined mental health as a state of well-being. So health includes both mental and physical health. So coming to the mental health part, actually WHO has defined mental health as a state of well-being in which the individual should realize his or her own abilities and can cope up with the normal stresses of life and can work productively and fruitfully and is able to make a contribution to his community or society. Means he should be able to, an individual, who is he, what is he, and his own mental abilities, and he should maintain the social relations, and he should be able to cope up with the various stresses in the life, and he should work productively. He should have his own earnings, and he should live a fruitful and a very peaceful life. That is mental health, and he should contribute to the society. So now, so this is not. So what are the major this? So what are the major factors impacting the mental health? We are talking in with respect to the HIV infection. So first thing, any person who have diagnosed with HIV and AIDS, in the beginning, he will have a lot of mental effects like depression, anxiety, and that. And he will always feel, he or she will always feel that his HIV status will be known to others, and this will cause a lot of problems like social and a lot of community problems with him. And there is a lot of stigma and discrimination is linked with HIV in the society even till now. So this is the biggest problem with HIV, and gradually this stigma and discrimination is coming gradually day by day in our societies, but still it is a major impact, causing a lot of to carry out control measures. Stigma and discrimination is coming in a big way. And for HIV patients, there is poor access to social support and mental health services. They can't come out very freely into the society, and they are unable to reach the government support, going to ART centers and seeking a mental service help. It is difficult. Difficulties they are facing. And majority of HIV patients, sometimes they feel that there will be especially in the women and child folk, there is a gender inequality, and some people will have an alcohol addiction, and smoking and drug abuse also is causing associated risk factors for having a mental health problems. And for HIV patient, you will see in the society sometimes because there is a lot of lack of understanding, family support, patients are not able to get. Poverty, low income, and unemployment and birth stress are also another factors causing the mental health problems in HIV people. So sometimes HIV people will have other cognitive and neurological and emotional disturbances that also affects the mental health of HIV people. And if we have been stamped with HIV, there is some problem in getting marriage. Even after marriage, there is a problem of divorce. Divorce fear is always there with the other partner. So now we discuss how a HIV person will get substance abuse can affect the HIV infection acquisition and other psychological issues. So health risks. Health risks means drug abuse will cause some health risks like addiction. Alcohol may cause addiction, drug abuse may cause effect on the health system, especially in the liver, kidneys, and all other metabolic systems. Health risk will be there. So under the influence of drugs and alcohol, so there will be an impaired judgment. Sometimes the sense of having awareness when the alcohol intoxication to wear a condom, to put a condom, they forget, and without the condom, they do a safe sex, and they'll get HIV infection. So alcohol abuse is very important risk factor in getting a HIV in most of the cases. And another thing, drug abuse will lead to addictions. So alcohol will lead to addiction, and it leads to health problems like cirrhosis of the liver and psychological problems, and it will affect on the brain. So many things with addiction, health problems. And because if any person becomes a strong alcoholic, he will have a strained relationships with the society, friends, family, and everybody thinks that is alcoholic means the social weightage in the society will come down in alcoholics. And legal issues means in drunken state, several crimes and these things will be done, and road traffic accidents under the influence of alcohol. And with these legal issues, and police will come into the picture and will get arrested. And all these things are all with the drug abuse and alcohol abuse. So these are the effects, because once you know that HIV patients will have a lot of um, effect on the mental abilities. It causes, it's called post-traumatic stress disorder. This is called a PTSD. Majority of HIV infected patients will feel this because of several factors. One is increased stress levels. Once they got know that they are having HIV, they feel always stressful. And once they are feeling more of tense and all, their immune system, definitely it will have an impact on the immune system, and they're much prone to other infections. And once they are on a lot of stress and all, and so it affects on the antiretroviral treatment, HIV treatment adherence also. They may be not very punctual to take the HIV drugs in time and all. So this overall, it will lead to reduced quality of life. They can't enjoy the life totally and very effectively. And it leads to a decreased mental health, and they'll have some sort of depression, anxiety, all these type of psychological and behavioral health problems will come. So it will lead to social isolation. Always they feel they are separate, and social, there will be a social, they feel that they will be outcasted, and they lead to social isolation, and the social isolation in turn produce depression and anxiety. So sometimes these people will feel some sort of problems with antiretroviral drugs. Once they are on antidepressants, there are drug reactions with some antidepressants. This clinician should take care, should keep a watch on what drugs they are taking, any drug side effects with the antiretroviral drugs. So how an HIV can impact the mental health? HIV disease itself, if you won't treat, it will directly affects the HIV on the brain and causes HIV dementia, HIV associated neurocognitive diseases, and it's called HAND, HIV associated neurocognitive diseases. Means some sort of mental abilities will come down, and they'll have a loss of memory and mental dementia, and early onset of senile dementia, and all will come with untreated HIV. And sometimes a long duration HIV also have neurological effects. So illness effect. If an advanced HIV patient, advanced HIV infection will cause some sort of illness like overall they'll get a loss of weight and their appetite will come down and they'll get loose motions and all. All this illness will cause a lot of social psychological impact. They'll get depressed. Sometimes treatment drugs, ARV drugs. ARV drugs means F-average. Sometimes previously we are using this class of drugs like NNRTIs. This F-average will cause some CNS side effects like sleeplessness, disturbed sleep, and sometimes depression, suicidal effects are known to be caused by the F-average. So nowadays with the newer regimes, F-average is becoming outdated, and gradually all the patients on efavirenz based regimes are shifted to other drug regimes like integrase tan transfer inhibitors like dolutegravir, etc. And another thing is HIV treatment and management is relatively expensive. So this causes a lot of financial burden for middle and lower middle income group people, and purchasing of ARV medicines monthly is becoming a problem, and investigations like viral load are all expensive, like 4-5 thousand rupees, and these things we several people may not able to afford. So in that cases one should advise the people suffering with HIV and AIDS to go to ART centers and get medicines free of cost from there, and even viral loads are also done at free of cost in ARV centers. So you know that this is there since beginning, and gradually our target is to reduce that stigma and discrimination to 95, 95, 95 levels by 2030, and it is one of the part combating the stigma and discrimination in elimination of HIV. So diagnosis of mental health issues means once a patient get HIV, there is another. Once a patient get HIV, so immediately patient will feel, a person will feel that he denies it, because how can I get HIV? Never, it is not possible. I think one or two single episodes of sexual encounters. How can I get HIV? Most probably it is a negative test. It's a laboratory error, or it is by mistake. The report has come like this. Patient will feel that he will deny the test report sometimes. Once after that phase, the patient will undergo a phase of anger on himself. Why I should get these things, and how can I live rest of my life with HIV positive status? Such type of feelings will come to majority of patients, and subsequently they accept this, and they undergo a state of depression. This is another phase of HIV. After knowing the HIV, that they got diagnosed with HIV, and after depression, immediately they'll have along with depression, mixed anxiety, depression, fear, and all these things is a complex psychological state. A majority of patients of HIV after diagnosis they undergo. After sometimes they think it over, several sleepless nights and all. After sometimes they get accepted that they had an HIV, and they reconcile, and they'll seek for treatment with a good counseling and good treatment. They'll come out of this, and they'll try to lead normal lives. So how to get diagnosed with mental health issues means we have to find out. The treating clinician should find out whether HIV infected is suffering from a health issue, mental health issues. Like they should use the screening methods like tools to diagnose, and most important thing is counseling, repeated counselings. So repeated interactions, a long duration interactions with the patient a patient will come out with symptoms of psychological issues like depression, anxiety, and if there is, we have to inquire with the patient whether there is a family history of any depression, anxiety in the family, psychological, assess the symptoms of severity and their impact. So we have to encourage the patient to have a open discussions. If required, if the severity of psychological symptoms are more, they have to discuss with the psychiatric specialist, and specific any antipsychotic drugs should be given to the patient, and we should be fully aware that antipsychotic should not cause a drug-drug reaction with the taking ART drugs. So we have to keep on a close watch on the patient's mental health and monitoring the mental effects and psychological, social behavior, or so these behavioral changes. So how to maintain a good mental health in HIV infected? There are several general tips only. These are all. So every patient, every clinician, HIV treating doctor should counsel the HIV patients and try to educate them, and try to counsel them repeatedly to avoid drug, alcohol, and tobacco abuse. And all the HIV patients, infected patients, should be encouraged to have a social mixing, and they should eat well. Very important aspect of treatment is taking a very good nutritive food, and they should sleep well for at least for 8 hours, and they should have a good regular exercise. Will keep the mind fresh, and at least 45 minutes to 1 hour exercise a day is really needed. And if they are all working group and this thing, they have to manage their stress levels. And so definitely relaxation techniques like yoga and meditation will have its own effect on reducing the psychological stress and symptoms. And so everybody should have their own passions and liking, dislikings. So they are encouraged to do the things, whatever good things they are good for their health. And there are several help groups to help whenever any HIV infected will get a depression and psychological and behavioral symptoms. They should seek the assistance of an expert and get relief of the problems. And another thing, nowadays WHO is coming with a slogan and all, you is equal to you. Everybody should proactively propagate into the HIV infected people. They should take into their this thing that once the patient is on ART treatment, on ART, so they will be become undetectable virologically within 4 to 6 weeks. In 4 to 6 weeks, with the present day good antiretroviral regimens like integrase strand transfer inhibitors and NNRTS and protease inhibitors. These are all very effective drugs. With these effective drugs, within 4 to 6 weeks to 8 weeks time, so patient, if they take good, with a good adherence, they will become undetectable. Means they will be no measurable or a circulating virus, active virus which causes damage to our body will be almost suppressed. Once they get a good suppression, they will become undetectable for viral loads. Once they become undetectable, their health will be maintained. They'll reach to a near normal health, and at the same time, they won't transmit the virus especially by to the sexual partners, even without condom. Even without a condom, they don't transmit once a patient is on below detectable levels. In a well suppressed below detectable levels, that is target not detected. So nowadays we are advocating condomless sex to the partners. So there is no risk of getting HIV to the sexual partner once they are virally suppressed, that is, their viral loads are below detectable. So that is called zero risk of transmission to the sexual partners. That everybody must know this. And once they are all on below detectable levels, their health is almost maintained to a normal distinct levels. Nowadays, we are saying that you is equal to me. There is you should know in this contest that there is a movie is coming in the next, in another 10-15 days time. It will be released in the YouTube channels. that the title called U is equal to me. That means once a patient is taking antiretroviral treatment becomes undetectable, so there won't be difference between a non-HIV subject and a HIV person. So U is equal to me means the opposite person who doesn't have HIV infection is equal to a HIV person. So everybody must know that, and we should encourage equality, and we should try to drive out all the stigma and stigma and discrimination. And once if that goes, it is very easy to control and eradicate. We can reach the targets by 2030 that ending HIV is possible. So the biggest obstacle is stigma and indiscrimination and child and women abuse. These things should go. Once these things should be tackled, addressed very well, the mental health problems in HIV also will be reduced drastically in the near future. Thank you very much for all who are taking their time in the Sunday morning and coming to hear this webinar. Thank you. Hello.
Sir, chat box is there, sir. Hello.
Chat box.
Kinda unta sir, kinda. అది మినిమైజ్ చేయండి సార్.
చాట్ బాక్స్.
Yes, sir.
ఎంతమంది, how many people? Good morning, doctor. Yes, sir. Full view. Good morning. Very nice. How to come out from depression after taking medicines. So how to come out from depression after taking medicines? So medicines, ARV medicines will make you more healthy. So once you start taking medicines, so after 6 to 8 weeks, your HIV virus in the active HIV virus, which is causing a damage to our body, will get almost suppressed and go to undetectable levels. Once you become undetectable, your health will become gradually improved. So the thing is only depression. Depression medicines means only some drugs cause some depression, like efavirenz, I told you. Efavirenz is one of the medicines in this cocktail. So usually in treating HIV, we will give 3 to 4 drugs, minimum of 3 drugs. One of the drugs, combination drugs, is efavirenz. Some drugs will cause some sort of psychological effects on the patient, in addition to sometimes causing virological suppression. Efavirenz will cause some sort of an anxiety, depression, sleep disturbances, suicidal tendencies and all. If we find that the efavirenz is the cause, we'll change the efavirenz to other drug. Take out the efavirenz and giving a dolutegravir or null, whatever in the government programs also is being done. Now the efavirenz is totally gradually taking out and it is replaced by dolutegravir. Previously, TLE regimes are there in the government this thing. Now the TLE has become TLD. Means efavirenz is taken out and TLD, dolutegravir, is put. So another thing, how to come out of depression means, I told you now, this you have to come out, mix the society, and if you feel that you are depressed, you have to go to the psychiatrist or somebody to have a counselor to get a repeated counseling, come out of depression, and try to involve in your day-to-day work and keep yourself busy. And all these things will help you in doing exercise and meditation, yoga, taking a good food and having a night good sleep. All these things will help you to come out of the depression. How to avoid anxiety? Same. To avoid anxiety means if you are having anxiety, the physical measures like good sleep and yoga, meditation, keeping yourself more concentrated on your profession, keeping yourself busy and not taking alcohol, drugs and smoking, and doing regular exercise, And if you are having more anxiety, go to a counselor and get some repeated counseling. In spite of that, you are having anxiety means they'll give an anti-anxiety drugs and all. So with this, you can calm down the anxiety. Doctor, for HIV, any injections available in India? So injections are available means, for HIV, you have to take a treatment like antiretroviral treatment. Now, all the antiretroviral treatment presently we are having in India are by taking a oral tablets. Oral tablets will suppress the HIV infection, cause you undetectable virological suppression, will lead to you good health and no transmission to others, right? Like that, in place of HIV oral medications, there are injectable medications also available in the in US, in Western market. So that is once a month injection, once in 2 months injections are all available. Once you take injection, 2 injections in 1-2 months time. So in those 2 months time, you need not take any medicine. That injections will keep you virologically suppressed and below detectable. But those injections at present in India, there is Indian companies are not manufacturing. They may be coming with those injections soon. But the present day, if you want to get the injection from Western world, it will cost you around 2 injections will cost you around 70 to 80,000 rupees per month or 2 months. It is not worthwhile if you see in a cost factor view. So wait for some time, a year or two, you may get injection. So injection should be taken once in 2 months. So it will, by the time another 1 or 2 months, the cost may be around 10-15,000 a month. That is also not so affordable. So this is coming 1 or 2 years, the cost of injections may be high. Doctor, I am using first line drugs for last 5 years. Till how many years drugs will work? So you see, this HIV infection as such is not a curable infection. So there are several infections which will come and stay in our bodies for lifetime. They won't go, like hepatitis B, HIV, some chickenpox virus. Some viral infections will not go. So likewise, HIV infection will never go from body for the present times. So, so now you have to, HIV is a manageable disease in a long run. Means like any chronic manageable diseases like high blood pressure, diabetes. HIV is like one of them, like one of that type of diseases. So you have to take the drugs, keep the drug disease suppressed and keeping on taking drugs. So you have to take drugs for lifetime and see that, say, suppose if you are having diabetes, you are taking diabetic medications and keeping the diabetes under control, and you check the diabetic blood sugars once in a month. So whether your sugars are not controlled and not under control. If it is not under control, you change the drug or you increase the dose. Likewise, in HIV also, you have to take drugs for lifetime, and you have to check that whether drug is working and virus is in the below detectable levels. So you have to periodically, once in 6 months or once in 1 year, you have to check the HIV status of your body. If it is well suppressed, well and good. Otherwise, we have to change on medicine and keep it suppressed. So these medicines you have to take for lifelong. If you with a good adherence, means without stopping medicine, you have to keep on taking, and you have to keep on checking once in a year whether you are suppressed or not. So this is very important. Everybody must know that that HIV medicine should be taken for lifetime, and they should check once in a year at least viral loads, whether their virus is well suppressed, below detectable or undetectable. Doctor, by which test have HIV status immediately? So best is HIV combo antigen antibody based test using a 4th generation ELISA. After exposure, you can, because of the new generation test, you can test HIV whether it is there or not within 6 to 8 weeks time. we will know it. Unless previously we have to wait for 3 to 6 months. Now the window period has come down to 6 to 8 weeks. So if you can able to test blood after a suspicious exposure, a high risk exposure, you test at 8 weeks period after exposure, then you can know immediately. If you want to know, means with less less reliability, and less sensitivity and specificity, less specificity, you can go for a DNA test like RNA test. So HIV RNA qualitative or HIV DNA through a viral DNA detector, you can go after 72 hours or so. Thank you. Okay, these are the questions. So any questions, any clarifications? Thank you very much for patiently.
Which is completed, sir.
Babu.
Sir, all questions covered, sir. All questions covered.
Okay, shall I?
Yes, sir. I see.
Yes, sir. Thank you, sir.
No more new queries in the chat box. So with the permission, we can conclude.
Oh,
Yeah, I see there are no more queries. So with your permission, we can conclude. Thank you, sir. Thank you.
Thank you, sir.
thank you very much.
Thank you.